Day marks World Prematurity Day, and this year's theme aims to shine the spotlight on the huge benefits associated with immediate skin-to-skin care for newborns and infants. Globally, approximately 10 million babies are born prematurely each year. Around 10% of these babies die within the first 24 to 48 hours. Now, prematurity has both short and lifelong consequences for the infant, with a high risk of mortality as well as long morbidity. Joining us is Stasha Jordan, who's the Executive Director at the South African Breastmilk Reserve. A very good afternoon to you. Thank you so much for your time. As we commemorate this day, why is it so significant?
Well, World Prematurity Day is very significant because a large number of babies are born prematurely each year. And in South Africa, we have recorded 86,000 births that are premature annually, of which 10,000 demise in the first 10 to 24 hours. So it's really an important time of the year because we have to engage in health literacy, where we are informing the population of the importance of accessing antenatal health services, the Bank Plus system, to visit your nearest clinics during your pregnancy, so that you may be in a position to early diagnose your potential high-risk pregnancy. So not all pregnancy reach 40-week gestation, and oftentimes this is not a conversation you want to have with the new mom, but it is something that we have to plan for and perhaps be aware of, and that is why engaging with the healthcare professionals that look after you in your pregnancy is absolutely essential.
And in advocating for health literacy, it's important for one to get a sense of the impact this can have on the infant, as well as the families who are unexpectedly thrust into the trial of lengthy hospital stays and having to deal with not leaving immediately or after 4 days or whatever the period may be after giving birth. I mean, the dynamics around that understanding and its impact on the infant and the family, how much of an impact does that have on the family?
We can talk about broken dreams, you know, and I think we have to talk about compassion in healthcare. We have to talk about dignity in healthcare, because there is no woman who falls pregnant expecting to give birth. You know, a full-term pregnancy is 40 weeks gestation. So now imagine you suddenly are thrust into a early birth at 24 to 28 week gestation. You suddenly have this very tiny baby. I mean, we lovingly call them see-through human beings because you can really see through them. There is a lot of psychological impact that affects the mother and the family, and it's a lengthy stay, and that's why we call them NICU warriors. And we say nobody fights like a preemie, because premature babies fight and their parents fight for them, and the community should rise around these families to support them during this time. So it's really essential that we practice elements of skin on skin when the babies are born, so that we place the babies on the mother's chest. That's the best incubator, obviously provided that the medical situation allows for that, because, you know, some babies are born so vulnerable they can actually not be weighed because they are so tiny. So before you can do skin on skin, there is also quite a lengthy process, and this can be quite a grueling experience for mothers in the neonatal intensive care units, and mothers and fathers and families, you know, at large.
And how can hospital facilities now support this? I mean, the skin-on-skin and kangaroo care that you talk of to help stimulate the newborn?
So in the public sector, I have to say, I've worked in this environment for 20 years. The Department of Health is incredibly committed towards availing mother lodger facilities for babies who are admitted to the neonatal intensive care unit. And I think that the private sector is slowly following suit, because mothers need to be in proximity to their babies so that they may be able to lactate. And for this to be, and babies usually breastfeed on an average every 3 hours. So for a mother to lactate effectively, and also for there to be that nurturing environment where we are building the maternal and paternal bond between the mother and the baby, we have to have time with a baby that is in the neonatal intensive care unit. So a mother or a father are never a guest. A mother or a father are an essential incubator and an essential, emotional support for these very little and very vulnerable patients.
What have you found to be some of the reasons why some mothers breastfeed while others don't? I mean, how do we begin to make sense of those who perhaps choose not to, as opposed to those who cannot?
So a very few mothers choose not to breastfeed, and I think circumstances, capacitation of the health system, all play a role. So we show an initiation of lactation which equals to 60% of the birthing population. And that is really the mothers that give birth vaginally. Whereas when you give birth through a cesarean section in the public sector, often the baby will become part of a system which separates the mother and the baby because of the fact that we are stretched to the limit, not for a lack of effort from any part, but really because we are dealing with a public health situation, which is something to reckon with. 30% of birthing mothers are HIV positive, and we have to be cognizant of the needs that arise with that. Also, when mothers give birth, through cesarean section, they're often sedated, so they're not often fully conscious. So we need a real, fully stocked team of professionals behind them. And at this current moment in time, staffing the health system is a challenge. And it's a challenge that the Department of Health is taking head on.
In being behind the mothers who've just given birth, also perhaps is the matter of postnatal depression, how that can also have its impact on the mother in terms of breastfeeding and other feelings which may come with it. I mean, imagine that, and also having to now deal with a premature newborn. What sort of support system is there to help such a mother?
Well, you sound like a mom yourself, so you can imagine postnatal depression affects a lot of us naturally, even when we give birth full term. So when a woman gives birth at 28-week gestation, she's traumatized, and she needs support, and she needs healthcare support, and she needs vicinity and proximity of her family, of her clan, of her people to support her. There are a lot of ups and downs, a lot of moms, there are a lot of support groups for moms that have neonatal babies due to the fact that that this is such a challenging time in a premature baby's life. So it's really important that we, we build the team, that we're the springboks behind our breastfeeding mothers, that we offer them that support that they need so that they can mitigate the challenges. And also we have to remember that we have situations where mothers oftentimes, will try and express, and we have different situations. So when you give birth naturally and full term, your baby latches to the breast. And that is a different dynamic to when you have to express for your baby manually or with a breast pump, and your baby is admitted and it's ventilated or it's on life support, and this becomes incredibly problematic, you understand? So I think what is really important is that the mommies that have given birth prematurely are recognized as special needs patients, and that they're given the support that they need nutritionally, psychologically, and that they participate in groups. If you're a mom of a premi, please reach out to a premature support group so that you may get the support that you need, you know.
I like the support group being linked to the Springboks. I think that's a nice way to put it. But as you describe premature births, would you say that they're preventable, or is it a matter of them being inevitable?
So I'm not first and foremost, I'm not a healthcare professional. Yeah. So we work with healthcare professionals, and there are a variety of situations. Every patient is an individual and an individual case. So you have premature babies that are inevitable, and then you have prematurity, which is avoidable, which has to do with health practice. And research evidence points to the fact that prematurity is directly associated with the development status of a country. So more developed countries have lower levels of prematurity, where poorer countries display higher levels of prematurity, which are often related to psychosocial situations which characterize prematurity. So there is a variety of situations, and it's really very difficult to just, give a one answer. There are so many reasons to give birth prematurely. HIV status is correlated to prematurity, as much as hypertension. And then there are so many situations which could deal to prematurity, which I think would be best answered by an obstetrician or a gynecologist.
Yeah. And very lastly, before we let you go, so what role do you play as the South African Breastmilk Reserve in assisting mothers or children or newborns that need breast milk?
So I think we want to take a step back, and I would like not to talk as a SABR, but just on behalf of the human milk banks. Yeah. I think what is really important for mums to understand is that breastfeeding and skin on skin, which is really putting your baby on your chest without any clothing on, is first of all a form of incubation. You're helping your baby survive, helping your baby regulate body temperature, but the role that that plays is that it also assists for you to lactate properly. So now, what old wives' tale used to say, 9 months in the tummy, 9 months on the chest, right? Because that is how it was. And when you have your baby near you, you're capable and your breasts lactate better than when you do not have your baby in your vicinity. So breast milk is, first of all, the first nature-made vaccine. It's built from all the immunological library that is contained within your life cycle. So if you are a mom, depending on how old you are, you have acquired an immunological library. You pass this immunological library to your baby through your breast milk. And in this way, you save your baby's life. So you can imagine why donated breast milk becomes essential when you have a 600-gram baby that is extremely low birth weight and needs mother's own milk so that they can strengthen themselves, so they can strengthen their guts, and they can it's an essential component. So, but oftentimes mummies are themselves not conscious. They're themselves in ICU. They perhaps are not able to lactate yet because of their stress level, and this is where the human milk banks play a key role in saving lives.
Yeah, very well. Thank you so much. Thanks for that. Joining us there was Stasha Jordan, Executive Director at the South African Breastmilk Reserve.